Let's be honest, when someone you love needs constant support, figuring out the right path can be, well, it can be overwhelming. There are so many questions. So in this explainer, we're going to demystify one really powerful solution: 24-hour home care. We're going to get some clarity on how it all works.
And really, this is the question that's at the heart of it all, isn't it? How can you make sure your loved one is safe, they're comfortable, they're cared for around the clock, especially when you just can't be there yourself every single minute? We're going to break down exactly how 24-hour home care makes that a reality.
So, first up, let's talk about the real-world challenges, the things that lead families to even look for this kind of support. What are those core anxieties that come with trying to provide care 24/7?
Oh, this is a huge one. It's that fear in the pit of your stomach. What if something happens in the middle of the night? A fall, a medical crisis, a moment of confusion, and no one's awake to help. That feeling can be such a heavy, heavy burden for a family to carry.
And here is the direct answer to that fear: having a trained professional right there, on site, 24/7. This means an immediate response. It's not just about peace of mind, it's about practical, skilled medical attention that can often prevent a trip to the hospital in the first place.
You know, beyond all the physical needs, there's a really deep emotional reality. For a lot of seniors, especially if they can't get around as easily, the days can get incredibly lonely. And that isolation, it can take a serious toll on their mental and emotional health.
So the solution here is so much more than just having a person in the house. It's about real companionship. It's about conversations, sharing hobbies, doing activities together. It's about helping someone feel valued and heard and connected to the world again. Honestly, that's often just as critical as any medical care they could receive.
Okay, so how does 24-hour care tackle all these challenges?
Well, it all starts by providing that support in what is often the most comforting, healing place possible: their own home.
So what exactly is 24-hour home care? Let's break this down. The magic words here are continuous care, from a team of professionals who work in shifts. This is so important because it means someone is always awake, they're always alert, and they're always ready to help. And that help? It covers the whole shebang, from medical needs to personal support, all right there in the comfort of home.
And this right here, this really gets to the heart of it. There is just so much power in familiarity and comfort. Being at home, surrounded by your own things, your memories, your routines, while getting dedicated one-on-one attention, that can totally transform a person's quality of life and their sense of independence. All right, so now let's dig into what that support actually looks like day to day. It's a pretty wide spectrum of services, and it's all designed to cover everything from really complex medical needs to just helping with daily personal tasks.
You can almost think of it in three parts. First, you've got the skilled nursing care. This is the serious clinical foundation, all handled by licensed professionals. We're talking about crucial medical oversight, things like managing medications, wound care, monitoring vitals, basically bringing a high level of medical supervision right into the living room.
The second part is personal care assistance, and this is all about maintaining dignity and just keeping the rhythm of daily life going. You know, providing respectful, hands-on support with activities like bathing, getting dressed, and making meals. This ensures a person can live safely and comfortably day in and day out.
And a third part ties it all together: companion and mobility support. This hits on both emotional well-being through conversation and just having someone to talk to, and physical safety through things like fall prevention and helping with movement. It's really about supporting the whole person: mind, body, and spirit.
Of course, once you understand the services, the practical questions start popping up, right? How does this stack up against other options? And the big one, how in the world do you pay for it? Let's get into those details.
This slide does a great job of showing the fundamental difference between home care and assisted living. Really, it boils down to one-on-one versus group care. With home care, you get that super personalized attention in a familiar place, which maximizes independence. Assisted living, on the other hand, provides care within a more structured residential community. Two very different approaches.
Now, when we talk about cost, accessibility is obviously a huge concern. And seeing a number like this, 100 plus, that shows there's a major effort to work within the healthcare system we already have. Being able to accept over 100 different insurance plans can make this level of care a truly viable option for a lot of families.
And here's what that accessibility looks like in the real world. Coverage can come from all sorts of places that families might already have access to, like private insurance, Medicare Advantage plans, or long-term care policies. Plus, there are specific routes through Medicaid, veterans benefits, or even workers' comp.
The big takeaway here is don't just assume it's out of reach. There are a lot of avenues to explore for financial help, so it's so important to look into all the possibilities.
For any family going through this, the process itself needs to feel clear and manageable, not overwhelming. It's really a simple 3-step approach. It all starts with a phone consultation, just to understand your unique situation. Then, that's followed by an in-home assessment to build a truly customized care plan. And finally, the most important step, matching your loved one with a caregiver who isn't just skilled, but who's also a good fit on a personal level.
You know, at the end of the day, beyond all the logistics and the services, the real goal of this kind of care is to arrive at an emotional destination, peace of mind, for everyone.
And there is nothing more powerful than hearing it from someone who has actually been through it. When Etta Kuttner talks about the care for her 92-year-old mom, the one thing she highlights is her own peace of mind. Just knowing her mom was safe, and not just safe, but in a trusting, positive relationship with her caregiver, you can't put a price on that.
And here we see the impact on the person actually receiving the care. Celia Miskey says that with home care, her aunt is happier and more secure. And that combination right there, that's the ultimate goal. Creating an environment that feels positive, stable, and even joyful.
So as we wrap this up, it all comes back to a personal question for you. Every family's situation is completely unique. If you think about your own circumstances, what specific kind of support, whether it's medical or personal or companion care, what would truly bring your family the most comfort and the most peace of mind? Answering that question, well, that's the first step to finding the right path forward.